fire alarm system.
Thank you, Madam Chair. The agenda does a good job of describing the situation that currently exists at Porterville. What these additional funds are proposed for is to get into the construction phase of the fire alarm system upgrade. As I think you're familiar, the facility at Porterville consists of an older facility and a new 96-bed unit. So this this project integrates the older part of the facility with the new facility to ensure that the entire system is more reliable and more efficient. The new alarm system is able to pinpoint exact locations where there are issues and provide immediate response. The improved safety in the 24-hour consumer-occupied residential buildings will also address certain licensing deficiencies that have occurred and ensure that consumers and staff have the required fire, life, and safety protections.
Thank you. Any questions or comments from Finance or LAO? Nothing. Any public comment on the fire alarm upgrade at Porterville? Seeing none, we'll hold that item open and move on to issue number 4, oversight of the regional centers and community-based system.
In this issue, you know, when the governor issued the order for the second extraordinary session to address healthcare financing, one of the issues that was noted in that order was improved oversight of the regional center system. And one of the things that I think is important to note is what currently exists, the type of oversight that is already in place. There are extensive monitoring and oversight activities that currently occur, and those are things like the fiscal audits of the regional centers and the service providers, on-site monitoring of regional centers' compliance with early start and the home and community-based services waiver requirements, attendance at regional center board meetings at least quarterly and more frequently. The department attends those whenever we feel there's a need. And the Family Home Agency and Work Services on-site monitoring visits to regional centers and their vendors. Regional centers are required to implement performance contracts, and their progress on achieving the positive outcomes identified in those contracts is monitored. We also have the national core indicators data, and the core indicators are a nationwide standard that measures consumer and family satisfaction in areas such as health and safety, service planning, choice, employment, things like that. Then we also have the special incident report reviews. There is review and approval of regional centers' purchase of service policies. There's review by the Department of Conflict of Interest waivers for regional center staff and board members. There are various appeals and complaints processes that are currently in place. These include whistleblower complaints, consumer rights complaints, and the fair hearing process. There's also a review of annual regional center reports that describe the efforts being taken to reduce purchase of service disparities. And there are special on-site reviews and technical assistance that can be provided at regional centers as needed. The next question is whether there is currently a formalized process for public stakeholders to comment on regional center performance and outcomes. And their regional center board meetings are required under statute to be public and to allow for public input. Additionally, as I mentioned, the performance contracts that regional centers develop must include meaningful participation with the regional center's local community. So the regional centers must conduct at least one public meeting to solicit input from the community. There's also the purchase of service data, where each regional center must meet with stakeholders annually. in a public meeting to present and discuss data on purchase of services. As I mentioned there, the national core indicators, there's also a quality assessment advisory group associated with those core indicators. The department meets with the advisory group semi-annually to discuss the outcomes contained in the indicators and reports to receive input on potential action items and improve service provision. There are formal complaint processes in place that allow the public to submit concerns for review and investigation by the department. And then finally, we have our own internal consumer advisory committee. The next question is, what data is publicly available for general oversight of regional center performance? And the department has a significant amount of data on regional center performance, and some of these things include the regional center performance contracts and the year-end reports that we receive each year, the purchase of service reports we receive, consumer caseload and characteristic reports, the department fact book, which provides data on the number of individuals we serve, the types of services we provide. There are also regional center and vendor audit reports are also available, and then regional center salary surveys and administrative expense reports are available for public review if needed. Regional center policies related to, there are policies in place related to transparency, whistleblower complaint process, conflict of interest, zero tolerance for consumer abuse and neglect. And then the fourth question on this issue talks about the concerns raised related to the health and safety waiver exemption process. And I think, we've heard these concerns, and they're primarily focused on the process that we're using now to approve local minimum wage increases. As you know, many counties, cities have increased minimum wage above what the state requirement is, and one of the concerns that the administration has had with local minimum wage is that while it may be appropriate on a community-by-community basis, it's not necessarily something the state should have to participate in the cost of funding. However, in the circumstances of our providers, most of the providers that serve consumers within our system, the state is their primary source of funding. So what we have worked out is a process to be able to provide funding to regional center providers who need an increase due to local minimum wage impacts. So what happens is a provider will go to the regional center with a health and safety exemption request. The regional center will review it, determine if it has merit, they'll submit it to us. Typically, those proposals obviously have merit because without available staff, you're putting the health and safety of consumers within that program at risk. So the process is cumbersome, there's no question about that, but it is the available process that we currently have to address the local minimum wage issue outside a broader discussion of how to address that. And I think it's also important to note that one of the things about the health and safety exemption request is that it is a personal issue. It's based on a consumer by consumer basis. So it's not something that's easy to broadly apply. And but as I said, in the particular case of local minimum wage, it's a fairly easy argument to make that everyone is in jeopardy if you can't hire sufficient staff. So with that, happy to answer any questions.
Let's hear from LAO or Finance, if you have any questions. LAO.
Thank you, Madam Chair. Just to note, we agree with the staff comments in your agenda with regard to the Regional Center oversight and transparency of budget information. As we discussed in the previous item regarding CPP funding, for example, need for additional budget detail, and agree with the commentary as presented in your agenda. Further, as it relates to oversight issues, and also noted in your agenda, we have recommended that the legislature consider requiring DTS to develop a multi-year strategic plan for financing reform. Given substantial continued growth in the program, we find that meaningful restructuring of community financing methodologies, regional center operations, provider rates, et cetera, is critical to ensuring cost-efficient and effective program operations. The state has had significant momentum in this area, including task force work groups, requirement for a rate study as established through special session legislation. And in general, we believe that changes over the past several years have been made in terms of budget augmentations have generally been in response to improvements or deficiencies in the state's financial condition without real systematic and strategic consideration of the state's goals as a purchaser of these services or with regard to the outcomes of consumers and performance of the system. And as such, we believe a strategic plan could provide more accountability and transparency to the legislature and the public in the development of a new financing structure for the regional center system. We acknowledge it'll take several years to accomplish, but by having such a plan, the legislature would be in a better position by which to evaluate progress in meeting reform goals, making necessary adjustments, and otherwise. This plan, for example, could include detail on interim deliverables related to the rate study before that is due to the legislature in March of 2019. Thank you.
So I remember in meeting with previous leadership in your department on the disparity issue several years ago that I was struck. I operated on an assumption based on the department's relationship with the regional centers, and I was struck by some of the lack of data you all could access to give us a full kind of statewide perspective. So as you listed in your response to question 1, how you do maintain oversight over the regional centers, I guess my question to you is if you think that's enough, if that's adequate, should there be more?
Yeah, and that's a good question, Madam Chair. I think the question, part of the issue is, you know, as the Lanterman Act requires, regional centers are local independent entities. So the question becomes, I think, how far should the state insert itself into the business of a local entity? That being said, we recognize that there are concerns that have been brought up regarding expenditures within the system, and you know, I think what we've tried to do, and I think Assembly bill, the developmental services funding package, does a good job of tying resources to outcomes. So there are several areas that are that require reporting back to the legislature to you know, get information on how successful was the use of these funds. Additionally, we have proposals in the governor's budget related to the additional positions for regional centers, the 4-bed housing model, and those all have reporting requirements tied to them. So I think that is appropriate, and we're, you know, we've had discussions with the regional centers and are looking at other ways that we can find to make sure that the system is accountable and transparent.
So as you mentioned other ways, you know, reporting is one thing, kind of accountability and what we do with that information is another. So has the department looked at a dashboard system? I know Department of Health Care Services, we've had hearings over the years around, you know, accountability with the health plans as we've moved into away from fee-for-service into managed care. So if you looked at kind of a dashboard system, and so everybody would be clear when we get into, you know, the red zone, if you will.
Sure, and that
performance dashboard.
Yes, and that's something that obviously, you know, we'd be happy to take a look at. We don't have a system like that in place, but I think that a lot of our data would lend itself to doing that. So
it would.
yeah, we'd be happy to take a look at that.
Speaking of the data, you talked about in response to question 3, is it publicly available to allow for general oversight? Is it your sense it's user-friendly? You listed a bunch of stuff, and I will admit I have not gone to the website to see it, but I really wonder.
Well, yeah, and I do think, in fairness, sometimes when people are working with data and working with it regularly, it can become a little hard for.
Oh, it's a different
exactly.
language.
In fact, it was interesting because one of the concerns that Senator McGuire brought up at the joint hearing was that it wasn't clear how many homes we were developing. So based on that, that concern, and we went back and took a look at, okay, how better to display this. So we've provided that information to the senator, happy to provide it to the subcommittee if you'd like to see it, but it focuses on the resources we're developing for Sonoma. So happy to always open to constructive criticism in ways that we can make our data more accessible and easier to read.
And I appreciate, as reflected on page 19 of the agenda, it's the first time I've been able to see, after kind of asking for it for a while, this kind of really at the ground level reporting on regional center kind of expenses. And as we talk about the disparities, particularly on the, I always want to say point of service, purchase of service. I said the P wrong. The purchase of service level. It was very interesting to see the differences across regions, quite frankly. That was very helpful. I had another question. Oh, with regard to number 2, you talked, the regional centers are, of course, nonprofits. They have boards. They, of course, are required kind of under nonprofit rules and regulations to meet. And you talked about the annual meeting. What happens if a regional center doesn't convene one? Does the department have any stick?
Well,
Or what do you do?
Well, we work with them to ensure that they do that. The expectation is that those meetings are convened because they're required, and so.
Is there any report back to the department in terms of what was raised, outcomes, anything that happens since it's only one time a year?
We're able to get that information from regional centers. We have, as I mentioned, we have representatives who attend regional center meetings.
Got it.
On a fairly regular basis,
Okay.
and we make.
There's an end-of-the-year report. That is
Oh, yeah, and that, yeah, and the end of the year report that I mentioned earlier.
Oh, got you. It comes back to, okay, thank you. We'll open it up to public comment. Senator Monty, before I go to the public, you have any questions? Okay, thank you. Public comment, please, 2 minutes each, please.
Connie Lapin, thank you for including this issue of oversight with regional centers and looking at disparity issues. I'm particularly going to talk about health and safety waivers. We all now in the real world know that maybe they got more cumbersome because of the budget cuts, but they are cumbersome, burdensome, complicated, and most of all, not timely. It's like crisis intervention. It has to happen, and I'm not talking about the minimum wage issue. I'm talking about somebody needing more services and based on their IPP and I would say person-centered plan. So I want to thank you. The staff did such an amazing job, and I don't want to let this go because it's the same thing. It's urgent.
Thank you.
Madam Chair, Dwight Hanson on behalf of the Alliance. I've been doing this for 20 years with this field right now, so I've seen a couple of things here, and I would suggest that oversight is always important, and getting access to this budget documentation is always important. Let me suggest to you the thing that's missing right now is data. And back in 2000, we scrapped cost statements, we scrapped submission of data, cost information. We've never recovered from that loss of information. And questions keep coming up at these hearings. What happens when a program closes? Where do people go? The answer to those questions is not well known because we don't have that data and that information. A lot of this crisis kind of stuff would go along that lines. The issue of health and safety waivers for minimum wage is laughable as a mechanism. Back in 1980, when they created a rate mechanism, you had what was called unanticipated rate adjustments. When government made any kind of change like this, whether it was state, federal, or local, there was a mechanism by which programs would be funded for those additional costs. They were called community-based day programs in the model. That used to be everybody. Now it's just a very few because most of these are negotiated rates. But that authority to deal with these kind of unexpected changes that happen between rate setting mechanisms need to be reinforced now. So move forward from the historical. You just passed legislation in the MCO discussion that included the authority for beginning the rate setting methodology discussions. A lot of these issues that you're talking about right now should be part of that. I would urge strong oversight from the legislature on that process. With due respect to the task forces that are in place right now, these task forces are set by the secretary or by the department with named individuals by the secretary and the department. The expertise on how to resolve these issues is in the community. Come out to us as stakeholders, our organizations. Let us bring forward our own experts. Let's sit down and talk about this for the next couple of years and develop the system that will resolve these issues. No more from above down, but literally, I was part of a process in 1990 of the System Reform Task Force is what they called it. At the end of 3 years, it all got scrapped. Surprise, surprise, Senator, it was because it cost money to do better. We're going to find the same thing now. After 20 years of turning our back, it's going to cost money. But it's better for us to know that that's the solution than to keep coming forward with these questions now. Geez, where is everything? Let's get that process going. You have the authority now, and we really ask for your leadership. Thank you so much.
Appreciate that. Next witness.
Hi, Madam Chair. My name is Willie West, and I got to get going, but I'm here to talk to you about the self-determination piece, if I could, real quick. I've been on self-determination for 15 years on one of the pilot programs, and I just want to say we need to get the I can't think of the name now. We need to get the waiver going here shortly because, you know, we have deadlines and stuff, and I'm just worried about the waiver, and we need to get the waiver going. And if you need my help, I can leave my information, and I'll be more than willing to work with you on that.
Thank you.
Thank you very much.
Appreciate you for coming today.
Hi, I'm going to ask for the same exception. I have to fly out. I apologize.
Okay.
Nancy Chance, I'm the executive director of Choices Person-Centered Services and a family member. My husband has traumatic brain injury. My first thing is I want to thank you on behalf of all your efforts and what you did for the folks that in the developmental disabilities services, their families, and the people who provide services. This was first year I've been able to talk to my staff about good news instead of bad. So thank you for that. My issues are these. Under federal labor, the FSLA issues, we do have continuity of care issues, and I think one of the ways we can help that, not fix it, but help it, because we've got so many people going in and out of people's houses, is to clarify that supported living providers fall under a 40-hour work week, not an 8-hour day, and that IHSS and supported living providers are not joint employers. I think that would help. The other thing is that if we could do a person-centered approach to funding of services, literally look at a person that has a greater challenges and fund that, and people with less challenges fund that. I think it would really, really help. I know it's complicated, but I know it would help. Home and community-based services waiver, this is an amazing opportunity, and we're really ready to do it, but we need guidance from the state of California desperately. I have 6-day programs. I don't know if I should renew my leases. I don't know what to tell my board of directors. I don't know what I can and can't do. I'm also have my hands tied by licensing, and I don't have people that require a license that go to my day programs, but I have to have one. If we could get that relaxed on a case-by-case basis, I think that would help immensely. And on self-determination needs to happen. We need to get that waiver through. Thank you so much for letting me go now.
Thank you. Appreciate it.
It's okay. Evelyn Abu Hassan with Disability Rights California. I want to take an opportunity to thank the staff for talking about outcomes in the agenda for consumers with developmental disabilities. We are strong proponents of measurable, meaningful outcomes for the community. I want to talk a little bit about that because the regional center contracts require performance objectives and measurable outcomes, and we want to suggest some performance measures which we really think will look at measuring meaningful outcomes for the community. One is performance measures which indicate compliance with movement towards compliance with the home and community-based waiver regulations. Performance contracts, which look at the number of consumers who are in competitive integrated employment. We know we're moving in that direction. And the last piece about this is we know that there are a significant number of consumers that are staying in IMDs for longer than the 180-day statutory limit. So we want to see some performance indicators about how quickly we are moving those folks out of those placements and back into the community. And I also want to echo Connie Lapin's comments about the exception process to the waiver. It is challenging, it is cumbersome, and we do agree with the comments in the analysis that we need to look at ways to streamline that process and make it timelier. Thank you.
Thank you.
Hi, Judy Mark again from Autism Society of Los Angeles. So the people who know me know that I'm friendly, but I tell the truth. And to me, seeing this data that you talked about, Holly, I've known about this data. I call it geographic discrimination. I know that my son is 19, but when I first started getting involved in the system, I was told by a number of people, there are 7 good regional centers, 7 bad regional centers, and 7 in the middle. How do we tolerate that? How do we allow our system to have to just say it flippantly? That's not acceptable to me. It's also not acceptable to me when I hear from families who say, what regional center are you in? And I tell them which one, and they say, oh, aren't you lucky, I'm in this other one. And that's not acceptable because you live across the street, you do not get the services that another person does. And I call that geographic discrimination. It is different than racial or ethnic discrimination, because if you look at a Latina in one regional center who's getting more services than a white person in a different regional center. So it is across racial lines. And what can we do about this? It is about DDS providing the appropriate oversight. They have contracts with all these regional centers. It is also about empowering boards of directors who are supposed to be holding their staff accountable, their executive directors accountable for providing the services. I've sat in regional center board meetings where the board member says, oh, we just sent $800,000 of our budget back to the general fund. Aren't we awesome? It's like, did you ask whether all the people in your regional center are actually getting the services that they need? That is your job as board members. And so our system has problems. It has significant problems. And just saying that we need to have more oversight is not enough. We need to really figure out from the very basic level, what is the problem here? Why are people not getting the services they need? Why do we have people who are sitting at home all day long because they've aged out of the school system, because their regional center will not provide them the supports that they need to live in the community and to be in the community every day? And so one of those questions we need to ask is, are people living their dreams? Are people out there? Are people doing something in their life that is making themselves better? And if we are not getting the answer yes, then we are doing something very wrong.
Thank you. Next witness, please.
Madam Chair and members, Rick Rollins, representing ARCA, Association of Regional Center Agencies. We'd like to add our voice to the issue of the health and safety waiver and how broken it is and how it needs to be fixed. And we stand ready to work with the department and others to make sure that that process gets streamlined and becomes a better process. Thank you.
Thank you. Appreciate it. Next witness.